we're going to start recording, and you can see by pressing continue, you consent to the recording of the meeting. So, Borada, Paub, good morning. Welcome to our WEN Café on caring and the impact of COVID-19 on women's caring responsibilities. I'm Catherine Fuchs, I'm the Director of the Women's Equality Network Wales, and really delighted to welcome two fantastic speakers to the meeting, Carina White and Sarah Rees. And I'll be introducing them properly shortly, but we're really delighted to have them here to share their experiences of parenting during lockdown and caring responsibilities. But first, I'd just like to share with you the Women's Equality Network Wales's vision. Our vision is a Wales free from gender discrimination. And by that, we mean we want men and women in all their diversity to have equal power. So we connect, we campaign, and we champion women to ensure that that vision is realised. We are a membership organisation, and if you're not a member, I'd urge you to join us. It's free to join us, and we're a network of around 34,000 people in total, with our organisational members ranging from the National Federation of Women's Institutes to organisations like Quarateg, who I'm sure many of you know, who also work on women's rights. So you can also join as an individual member, and we'd really welcome you joining with us so that we can realise our vision, because we'll only get to gender equality if we all work together to achieve it. So this crisis really risks eroding the small gains in equality that we've made. And so our Women's Equality Network Wales, we've developed a COVID response that we're calling on Welsh Government mainly, but there are also some asks for the Westminster Government to focus on, so that we build back fairer. Now, we've heard a lot of talk about build, 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 but our COVID-19 response is about care, 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 and our #1 priority is around providing high quality childcare for many reasons that we're going to come on to discuss. Our second ask around our COVID-19 response is we need to protect women from poverty. We need to ensure women are safe at home. That's the third ask. Our fourth ask is we need to ensure women are safe at work, the right PPE and so on. Finally, we need to tackle gender health inequalities. So I know Meg's popped in the chat the detail behind that COVID-19 response, and you can read up on that later. But today is all about care. And we've all heard reports that and probably many of us have seen for ourselves and are living it right now, the fact that women have taken on more caring responsibilities in the home since this crisis started. So we're here to address this and to talk about solutions and hear about your experiences. So I'm delighted to first of all introduce Carina White from Dope Black Mums. Carina is also Head of Business and Brand Partnerships, Head of Operations for the Best of Africa Awards, the Black Collective of Media in Sport. She's also a school governor and a Dope Black Mums podcaster. And we're really delighted. This is the first time we've had Dope Black Mums in Wales talking to us. So welcome, Carina.
Thank you for having me. Hello.
Great. So my first question is, can you tell us about Dope Black Mums, Carina? What are your aims and why did you set up the group?
So the group initially was set up as a digital safe space by our founder, Nina Harrison. She wanted to have a place where she could connect with other mums that looked like her, sounded like her, and might have the same sort of experiences when trying to parent as a Black woman in the UK. She found there wasn't any other space like that, online or in person, so she set up the Dope Black Mums WhatsApp groups. And, you know, I was one of the original members in that group. And I think when we first set up, there was probably about maybe just 20 mums in there. We now have 2 separate WhatsApp groups, and there's over about 350 mums in that WhatsApp group, and we've got lots of more mums on social media and in our Facebook groups. And essentially they're digital safe spaces where Black mums can come and be unapologetically themselves, bring their whole selves, and where we can discuss, support and laugh and cry together. From that, we developed the podcast. So myself, Nina, and 3 other mums are part of the podcast group. And, you know, we do podcast episodes from anything from sex after childbirth to, you know, talking about domestic violence, talking about sickle cell anemia, which is a disease that, or an illness that affects predominantly the Black community. So our podcasts are very different. Although we're called Dope Black Mums, the podcast is for all mums to listen to and to learn about parenting from the Black perspective, to hear about our experiences, the challenges that we go through. And one of our recent podcasts that came out during Black Lives Matter was called Dear Dope White Mum. And it was basically calling on all non-Black mums to really listen to the podcast and listen to our experiences, listen to our frustrations, and understand how non-Black mums can really come together and help us fight discrimination and fight racism by helping to raise the future generation of children to be anti-racist, to be allies, to be global citizens. And that's probably been one of our highest listened podcasts. And of it, it's just been amazing because we've had so many white mums, Asian mums reach out to us and say, look, I really thought I understood, and I really thought that as mothers, we were all connected. And as women who are mums, we are all connected. And actually, I've realized that some of the things that you guys experience as Black mothers and as Black women, I will never experience that, but I can understand it, and I can try and be that ally. I can try and be that global citizen to help support you.
Great. Thank you, Carina. That's a really excellent introduction to Dope Black Mums. And can you share with us as well how's your experience of parenting been during lockdown? What's it been like for you? Because you're a school governor of a secondary school, but you've also got a 10-year-old child. So how's that been?
So, you know, the one thing that I think I pride myself on is I'm very open and honest and very authentic in what I say. I never asked to be around my daughter 24 hours a day. And mums who say, you know, lockdown's been brilliant, I take my hat off to you, because I did not ask when I became a mum to be around my daughter 24 hours a day. You know, normally they're at school. Normally, you know, they can go to grandparents. Normally they can go to, you know, friends' houses, or you're out the house. But, you know, being in the house with my daughter 24 hours a day, I've actually come to realize she's quite annoying, and she finds me quite annoying as well at times. And that's okay, that's normal. But in terms of, you know, childcare and stuff, it was really difficult because at the beginning, I was trying to balance working whilst, you know, school governor responsibilities, whilst trying to manage recording the podcast. And I found it really difficult. So at one point I was like, right, we are on half term for the foreseeable future for homeschooling. That's it, you know. And I'm really lucky because she's older. So, you know, if she's got her phone or the iPad or the television or a book, she will just entertain herself. But it wasn't lost on me that my friends that have got younger kids, that have got babies, you know, my sister's got, my niece is 9 months, my nephew is 2, and he's very much a 2-year-old boy. In that, you know, I've had to, just to give my sister a bit of respite, I've had to play hide and seek with him on FaceTime for like 45 minutes. Don't ask how I've managed to do that, but, you know, I think in comparison to others, I've had it a little bit easier because my daughter is older, and it's not lost on me that some mums have found it really, really difficult. And, you know, some of the mums in our group, in our WhatsApp group, they have said, if it wasn't for this group, I don't know what I would do, because it's been a stressful time. They're having to manage their husbands being extremely annoying, or their kids being around them constantly. And, you know, especially people who might live in flats or in overcrowding or in single households or in households with domestic violence, it has been extremely difficult.
Yeah, exactly. And we will come on to that, I'm sure, and get into more of the detail around the issues around being stuck at home with kids. But I'd really love to introduce Sarah Rees now. So Sarah Rees is a equal parenting activist and campaigner. She works with Pregnant Then Screwed in Wales, who do a brilliant job in helping women who are pregnant and suffering discrimination. She's also a law student and regional engagement manager for Bethan Syed MS, who's off on maternity leave, as I'm sure many of you know. She's also got 2 kids under 6, so she's juggling many, many hats. Welcome, Sarah.
Hi, it's lovely to be here.
Thank you for joining us today, because I know with all these different hats, both you and Carina are squeezing this in, as many mums are juggling. So can you share with us, first of all, as an opener, just how you found caring for your children during the pandemic here in Wales, and what have been the big issues for you?
The hardest bit for me was that in the earlier bit of lockdown, about in May and June, I was sitting my final law exams on top of a job that I started the week of lockdown, on top of having the children at home, my husband at home. And as I say, most days, the clacking of his laptop, you know, literally from 8 o'clock in the morning till 10 o'clock at night is the thing that really grates on my mind. It wasn't lost on me that I'd chosen to do this essay out of a number of options, but the law essay that I had to do for my finals was on divorce. So it's been interesting. I get my exam results next week, and so I'm hoping that I'm not going to have to do it all again at the end of August. But yeah, it's just, I think balancing all of that together meant that, you know, mental health was difficult to manage. Any exercise has been difficult. You know, the kids have learned a lot about how to upload Netflix on different machines as part of their homeschooling. And my bathroom is probably the worst thing that has happened recently. I'm glad no one's been able to come in my house and see how minging it's actually been. yeah. So that's been the crux of it, really.
Okay, so it's been difficult, and we've all been juggling different things, but what, in your particular experience around childcare and the childcare provision that you've been since schools have reopened and nursery settings have reopened, can you share with us some of your experience around how that's working or not for you?
Yeah, I mean, personally, it's the first time that we've been able to access some of the 30 hours. So we've actually saved money for the first time, because as a student, you're not eligible for any support with childcare. You know, so the cost of my course is double that of anyone who doesn't have a child. So taking on a job meant that we could access some of that childcare provision. You know, the week that we had the letter to say we were accepted, that was the same week as lockdown. So there was no childcare, but now that's coming back into place. It's been okay. What I've been really concerned with is the number of people talking to me saying that, you know, they've had no provision. On the phone line in particular that I'm supporting with Pregnant Then Screwed, we've had a lot of people calling in saying that their employers, you know, want them to return to the office, they want them to return to other workplaces, and they simply can't do that because their children haven't been in school. You know, there's been so much effort in Wales to get schools to reopen, and there was even a minister who mentioned that things will be easier for parents in this 4-week period that's coming to an end of reopening. In reality, that 4-week reopening of schools was, you know, 1 or 2 days if you were lucky. So it hasn't been a return to any sort of childcare or schooling for us to help.
Yeah, and I think everybody is, what we're concerned about at WEN Wales is the fact that women may be the last to go back to work, because if the childcare isn't there, then women will have to stay at home. We've seen research from the Institute for Fiscal Studies showing that women are doing more of the unpaid caring at home. I think it's like 2 hours extra on top of what they were already doing before lockdown. So what would you like Welsh Government to do, Sarah, in order to rectify this? And I've also got a kind of supplementary question, which is around the the difference between the private nursery setting and the state nursery setting, and this confusion as to whether you're eligible, that your child can go from one to the other?
Yeah, I mean, just to come before I answer that question, I think there is also the issue of mums were the first people to ask for furlough, to say that they had to leave their job in order to care for their children, because we're still the majority who earn, you know, who were the lower paid earner. So when it comes to it, if you've had to make that difficult decision, it's mums who've said, well, I can't come to work anymore. And, you know, when government is saying that they expect employers to be helpful, there are a lot of employers out there that have been saying to people, well, if you don't come in, then we accept that as your resignation, even though they don't have anyone to care for their child and they can't take their child to work. You know, I was a bit mad and went to IKEA yesterday and I saw a staff member heavily pregnant. Now, can you tell me that they're able to guarantee that she's going to be staying 2 meters from people? She shouldn't be in that workplace. And this is happening in a lot of places. You know, there are pregnant women who don't even know that their employers should be undertaking risk assessments to ensure that they are safe. And this is awful. It's really, really upset me.
Yeah, absolutely. We've I don't know if you'll know about this, Carina, but we've got here in Wales an advisory group, a BAME advisory group for Welsh Government, and they put in place a risk assessment that must be done for any BAME healthcare workers in the front line. But we're all arguing, along with the TUC, that this needs to be extended to all women who are at risk, and that's including pregnant women. Carina, can I come back to you and ask you what you think Westminster Government need to do to improve things around childcare and the provision of childcare in lockdown and then coming out of lockdown?
So I think childcare hasn't been just an issue in COVID. Childcare has always been an issue prior to COVID. So I don't want it to be COVID specific. I want it to be an issue that they address full stop. The cost of childcare is astronomical and a lot of parents can't access childcare because of the cost. And a lot of families are missing out. They're having to rely on family members to look after their kids, to pick kids up from school, or relying on after school clubs. So I think there really needs to be some balance in flexible working policies with employers. I benefited heavily from flexible working policies when you know, my daughter was a little bit younger and I was a single parent, and I made it very clear that, you know, I will be in early because that's fine. I can drop her off at nursery early, or she can go to breakfast club. But what I'm not going to be doing is, she's not going to be in breakfast club from 7:30 a.m. and then in after school club until 6:30. There's got to be some give. So I do think employers and governments should be putting the emphasis on employers for them to be more understanding and more flexible with parents that are juggling childcare. You know, I understand not every industry it's possible to do that, but for myself, you know, I would say I'm leaving work at 4 o'clock. I will be contactable on email until I get home, and then from the time I get home until bedtime at 6:30, 7 o'clock, I'm offline. If you need me to have a look at emails or answer anything like after those hours, then I'm more than happy to do that, because it's about compromise and it's about giving and taking. I think they need to be more you know, having days working from home. I worked from home every Friday because my manager was a single mum as well. So she totally understood that actually the benefit of being able to drop your child to school at least one day a week and be there at 3:30 when they finish to pick them up instead of them going to after school club actually makes a big difference. And it made me a lot happier during the week, and it made my daughter really happy as well to know that her mum's there to pick her up. So I think the government really need to look at enforcing some policies on employers, and also looking at the cost of childcare as well, because it's absolutely ridiculous. I know my sister and her partner, they have, you know, they have good jobs, they earn quite a good living, and yet they still struggle with having to put a 9-month-old and a 2-year-old in nursery. So if you're in a 2-person household and you have 2 children and you have good jobs and you're still struggling with childcare, then what about the ones that are in single parent households that are on minimum wage? What do we do about that?
Absolutely, couldn't agree with you more, Carina. We need flexible we need employers to be more flexible, and we need the childcare to be much cheaper and more accessible. And we talk about this in our feminist scorecard that we released just at the beginning of lockdown, actually. Was written before lockdown happened, before COVID-19. So the research, like you say, it's not just become an issue, childcare now, it's been an issue all along. One of the big things in Wales was that we wanted the childcare offer to start for younger children from 6 months, and also to be open not just to women who are working, to working parents, sorry. It needs to be available for those who are self-employed. It needs to be open to students, like Sarah mentioned earlier. Now, I'm really delighted. I just want to bring in Alex Davies-Jones MP, who happens to be with us at the Café this morning. Alex is MP for Pontypridd, and I think she's still with us. And I just wanted to ask her to say a few words about what she's heard are the key priorities from her constituents who are parenting in lockdown.
Yeah, thanks, Catherine, and thanks everybody for joining this morning. So I've come on as a spectator. I was invited by Julie, who's a friend and a constituent of mine, on Twitter, and I thought, well, I'll come along because I've also been trying to juggle childcare. I've got a 1-year-old at home during all of this, and it's been really, really hard. And I also sit on the Women and Equalities Committee as well in Westminster. So we've been seeking evidence on this and the impact that COVID has had on women, and in particular, women who are at work, pregnant women, the issues we've had around maternity leave. And I know Beth and Saeed as well has been doing a lot of this in Wales and looking at that issue. But it's exactly what you've been saying, really. We know that women are more likely to pick up the more caring responsibilities, the homeschooling, they're having to juggle working from home, or also having to, they work actually in the key sectors that have been working. So they work in the frontline NHS in terms of, you know, they work as nurses or doctors and cleaners, carers, or they're working in supermarkets and retail. So they've been having to do both. They've been having to make those tough choices of having to actually keep going to work and then having to come home and have to deal with homeschooling and caring responsibilities in the home as well. And it's not just caring for children. We know that women were caring for elderly parents. So I've got constituents of mine who've come to me who've said exactly what Debbie's just said. They're having to care for elderly parents or siblings who are unable to care for themselves, and they've had to juggle that with being able to do everything, and it's been really, really hard.
Absolutely. Well, thank you, Alex, for popping along to the Café and sharing your experiences. I think we are fortunate there's been a slightly different attitude to caring and to the response to COVID in Wales, but there's just so much more that needs to be done in both England and Wales in terms of supporting carers. And some people are making comments on the chat that it's not just parenting, it's also caring for elderly relatives. We also need unpaid carers to be able to access mental health and wellbeing support. 75% of workers in roles most exposed to COVID are women. So we've got a lot of questions here and thoughts from the panel. What, Alex, if you were Prime Minister, if there was one thing you could do to resolve this caring conundrum, what would it be?
It'd be making childcare free as a universal. It'd be making childcare free, because it's absolutely essential if we want to get women into work. There's been a lot of talk at the moment about, you can hear my son in the background. Yes, you agree with me. There's been a lot of talk about universal basic income and how that could help people getting back into work. But I think the priority should be on universal free health childcare. I think that's the big thing that I would make free.
Thank you, Alex. That's brilliant. And I love the fact that your son also voiced his opinion there. It's not the first time that we've been kind of interrupted in a nice way by our children on these WEN cafes and on our Zoom meetings. So coming back to Sarah, I know you wanted to fully respond to the question I asked earlier, so go for it, Sarah.
Yeah, I just wanted to come back to the question around what I would ask the First Minister to do. I think there's a there's a double response there. In the short term, I think we do need some form of summer holiday provision, because key workers had reliable childcare, and that's been, you know, taken from under their feet as the summer holidays have approached. And I've heard from key worker parents that are saying, you know, me and my partner are both working in the NHS. What are we now going to do? We don't have family nearby. We don't have the care that can cover our shifts. Something has to be done to help these people. And I would say, actually, differently to Alex, I've always been a supporter of childcare provision, and it has to be there. But I do think that in the long term, universal basic income is the way forward. You know, the number of children we've got in Wales that are living in poverty is awful. It should not be happening. And if we had a real universal basic income, you know, even just a pilot that was aimed at parents at the moment, then that would be amazing, because it would literally bring them out of poverty. I've talked to a lot of parents in the work that I've been doing recently around free school meals, and, you know, that provision hasn't been the best. There are some local authorities that are still giving out food parcels, and the pictures I've had, you can't even tell what's in these food parcels, and they're so they're just not made for families, that parents are actually donating food parcels to food banks because they don't suit their children. You know, if we had a universal basic income, we could solve these problems and no one would need to go to a food bank.
Absolutely. I'd like to come back to Carina. We've got a comment here, Carina, from Emily Durant, who's a single mother, a Green Party county councillor. She's also working for the National Trust. So she's ending up being the full-time carer, and she's got to attend council meetings. There's obviously no support for her for care for all the council meetings. What would you suggest, Carina?
Bring your kids with you and make a point of the fact that I'm having to, same that Alex, you know, she's on this call, although it's not work call, you know, the kids are in the background. We need to normalize the fact that we are mothers, and that, you know, if dad can't take the kids or dad's not around, then the kids are going to have to come with me, and it may not be appropriate, but we're going to have to just lump it and love it, because, you know, it shouldn't be, we shouldn't be putting mums under pressure of trying to do their jobs or trying to do commitments that they have, and putting them under pressure that they don't have childcare. It's not fair. And just back to my point when I was talking about flexible working, somebody commented about men. I also think something needs to be done about encouraging men to take extended paternity leave or shared paternity leave, and encouraging men to have working from home days to look after their kids, or having to leave work early to look after their kids. You know, parenting should be shared. If you're, you know, if you're living with a partner, it should be shared. It shouldn't, the pressure and the responsibility shouldn't just be on mum. It should be both. And, you know, I've noticed a lot of my male friends have said, you know, oh, I really understand what my girlfriend's going through, or what my wife's going through. You know, it's a lot. So I think some of them have realised, and some of them, you know, they've done what they've done best and just ignored it and continued as normal. But I do really think that, you know, for me, if I don't have childcare and I've got to go into work, my daughter comes with me, because I'm not going to stress myself out.
Emily, would you like to make a comment? Because I can see you sitting there. Please do.
Yeah, just simply that I do actually take my children, and I've taken them to full council meetings, training. They've come to 2 conferences with me. I've had lots of negative criticism. I've had some encouragement. I've had to pay a lot more to come with my children to conferences, which obviously is very hard to afford when you're a single parent. But the point is, I mean, my children will be in the background at the next full council meeting next week, but it's going to be really hard to concentrate. I can't really be analysing the budget and listening to all of the comments and taking it in and be ready to vote. I mean, I might miss the vote, you know, if somebody has an accident or whatever. So, yeah, I absolutely agree with you, Carina, and I'm with you on that. And I think we should all do that, if only to make a point, but it doesn't actually solve my problem.
I think it shows, doesn't it, that we not only need we need the right government policies in place, but we need to change the culture as well. And that's something at WEN Wales that we talk about a lot. We need, you know, it's going to take 10 years at least to shift the culture in our country around equality and making sure that women aren't the ones who are immediately called on to do the caring. So in the meantime, I love Alex's idea, universal free childcare for everyone, also a universal basic income, as long as there is a gendered approach to that. So yeah, I think that's really important. The other solutions we've come up with so far, just to recap, is Carina's point around imposing flexibility on employers is really important. I want to come and I'm just going to check the messages and see whether we've got any other comments. There was a comment which is really specific to Wales and rural areas in England, which is around there is no school transport now, and there may not be in September. That's what one of the participants in the chat is saying. So there's also no breakfast club and no after school club. So how is that going to affect women and going back to work? Carina or Sarah, who'd like to respond? Go, Sarah.
Yeah, I mean, you know, one of the things that has been an ongoing battle that I've said to Welsh Government is this whole issue of the 30 hours childcare. It isn't 30 hours childcare, it's, you know, 12 and a half hours in one setting and about 15 to 17 hours in another. When I first put my son into the 30 hours offer, there was no space on the minibus to do a wraparound. So it meant that I was going to have to work out a way to drop him at the one setting at 9 o'clock, do some work somewhere, pick him up at 11:30 to drop him to the other setting. They were then going to charge us an amount to cover the hour until the 3 hours fitted in from 1 o'clock in the afternoon. And we just didn't know how we were going to do it. That was, you know, removed as an option because of lockdown. But this is something parents face all the time. And it's absolute silliness that we're having to run all these rings around for something that should just be one setting that parents need to use in the way that they want to use it, rather than prescribing something that isn't suiting anybody.
Absolutely, thank you. Carina, go.
I was just going to add to that what I've noticed in my area in South London is that quite a few of the nurseries have started offering wraparound care. So there's a couple of nurseries, one of which my daughter went to when she was in nursery, that it's a 24-hour nursery to assist parents who may work shifts. And so you can book in for the 6 p.m. to 7 a.m. slots to have overnight care for your kids if they attend day nurseries, and they can have flexible days that they attend, but also it extends to the weekend as well. And obviously that was only for under 5s, but they were also looking into a way that possibly if a under 5-year-old was at the nursery during the day, is there a way that they could go and do school pickups from the local schools and then bring the kids to the nursery, so that the parents then just have to pick up the kids from one provider as opposed to going to do different ones. I don't know how it would work rolled out, but I thought that was a really good idea and a solution to a lot of parents' problems.
The other thing that I would like to see is, I know that Welsh Government have been providing free childcare for key worker children under the age of 5, and that hasn't been any specific amount. It's been exactly the amount of hours that they need to do their job. So I think we need to do some research into that. I know one parent, for example, in our local nursery, who is the first time she's been given such childcare for her job, and she works in Asda. You know, it's the first time she's been able to have a paycheck and it not go entirely on childcare, which I think is transformational for women.
Absolutely. I'd like to also talk about the care that grandparents are providing, and there's a person on the chat who's been talking about the fact that they've had to step in, and their employer, who actually happens to be Welsh Government, has been very understanding because they've had to step in and care for their 2 children. So do any of the panelists have some comments around caring for older relatives?
So I'm quite lucky because my dad and my stepmom are, although they're older, I'm not having to care for them. But what I have really missed out on is accessing them as carers for myself, and my sister I know has really struggled with not wanting to bring the kids around my dad just because of his age and being at risk and COVID and stuff. My family was hit really hard during COVID. We lost quite a few older family members. And I think what was really striking for me is that we couldn't go and visit family. We couldn't go and visit our older family who needed to be comforted in time of grief. So although it's not similar to having to care for them in the traditional sense, you know, we couldn't care for them in the sense of they're grieving, they've lost brothers, they've lost sisters, you know, so that for me was really difficult. So I find that if I found that difficult, I can't even imagine how people who actually had people to care for, older relatives to care for, how they managed to balance that with having kids and not being able to access suitable childcare or, you know, support.
I'm really sorry to hear that, Carina.
Yeah, absolutely. I'm also sorry to hear that, Carina, and I wonder whether you would like to touch on some, obviously what's been on a lot of our minds since the death of George Floyd in America, which is around the Black Lives Matters movement, and how that's been affecting your podcast and your group of WhatsApp mums in your Dope Black Mums WhatsApp group.
Yeah, I mean, it was a very, very, very emotional time for us. In the podcast episode that we did, I was extremely emotional just because I was just so frustrated, you know, not just during COVID, but outside of COVID. Black women are disproportionately affected with most things. So Black women are 5 times more likely to die during childbirth than any other ethnicity. So you find a lot of mums in our group that's been highlighted, that with the death of George Floyd and kind of the spotlight on inequalities within the Black community, or that affect the Black community, we had this narrative come up of these statistics of we're 5 times more likely to die during childbirth. We have mums in our group that are pregnant, and they're extremely worried about whether they're going to make it to 9 months alive, or whether they're going to come out of having childbirth, giving birth alive, or whether their child's going to be alive. We have mums in the WhatsApp group who have spoken passionately about why they think that these statistics exist, because they've experienced discrimination and racism within a healthcare context. And it's not the, oh, you Black person, it is, you know, oh, well, Black women don't really know their bodies, or they don't feel pain. So when they're saying, you know, we're in pain, they're not being listened to. So it has been a very, very powerful last few months. I think that for us as Dope Black Mums, we've kind of turned into mini activists, in that, you know, we have a platform, we have a voice, we have a responsibility to try and affect change and to improve positive outcomes for Black mothers and for Black women. So, you know, we are trying to, Pregnant Then Screwed, who I know Sarah is closely aligned with, they did a campaign, what do you call it? Where you sign it, petition, that's it. They did a petition asking for Black and Asian women to be protected during COVID, those who are pregnant, that they shouldn't be working. So similar to the lady that said that they saw the pregnant lady in IKEA, you know, we are being disproportionately affected even during COVID, that we're at higher risk of dying from COVID. I had 6 deaths in my family from COVID or associated to COVID. And as a mum, I found that really difficult because it's just me and my daughter at home. So I got to the point where I didn't want to answer my phone anymore, because it was like, I don't know if someone's ringing me to tell me about another death in the family, and I'm having to grieve. And the only person that's here to support me in grieving is a 10-year-old. So it's like, how is her mental health being affected by this? So I think a lot more needs to be done. the statistics around maternal deaths in Black women has been around for a while now, and nothing has been done. So we are hoping and campaigning along with other groups that this can be changed, and that some tangible research can be looked into for that. We are campaigning for the fact that we are more likely to lose our babies. So why is that? Because we're not predisposed to that. When you look at, countries in Africa and countries in the Caribbean, they don't have those same statistics, so it can't be something that we're predisposed to. So I do think that it's brilliant being able to be on a call like this, and being able to get that message out that actually it shouldn't just be our fight. Just because I'm a Black woman and I'm a Black mum, it shouldn't just be my voice that should be heard in things like this. It takes for all of us. There's 33 people on this call. It takes for all 33 of us to say, do you know what? We're all women, we're all mums, or we're all, some of us are men, some of us are dads. It shouldn't just be, the responsibility shouldn't just fall on me as a Black woman to say, hey, why are we dying at a faster rate than other mums? It should be for all of us to stand up and say, I don't agree with that, and what can be done about it.
Absolutely, Carina, and my heart goes out to you about your losses. And I think what we're trying to do at WEN Wales is take action and be positive allies and be anti-racist and educate ourselves, help educate our members, and we are all absolutely with you. I've got a couple of things on the chat that's come up, Carina. One is, from a single mother's perspective, how has your experience during the pandemic been? Actually, I think you've touched on that already, but I think, have you got anything else to add around solutions to meet the needs of single parents? And I'd also just like to raise something that the Fair Treatment for the Women of Wales charity have raised, which is there was a task force launched very recently to examine and challenge racial inequality in women's health yesterday, which is brilliant news. Thanks for raising that, Debbie. So Carina, any comments on that before we wrap up?
So yes, they have launched a task force, and I also saw that the chief midwife also have put in place some steps that all midwives and all maternity services departments should be adopting to try and prevent the inequalities in maternal health. Also, with the lady who said about single mums and support, I do genuinely feel that a lot of, we have this group, Dope Black Mums. It's brilliant for Black mums to connect and to receive support. And I would just say for other mums who do feel lonely, because I can myself, if it wasn't for technology and for keeping, those weekly Zoom calls with my friends, I don't know how I would have coped. But I do think that, try and build networks. Try and build sisterhoods, try and join sisterhoods. Dope Black Mums, yes, we're a safe space, but we also have partners that are not exclusively for Black mums, that we encourage women to join, to support, and to have that sisterhood, to have someone that you can send a text to or email and say, you know what, I'm feeling really low at the moment, and try and uplift each other. I do think, yes, the government have some responsibility, but also we have a responsibility to try and support each other. That is what's so brilliant about sisterhood. It's not just Black women supporting Black women or white women supporting white women. It should be all of us supporting each other to try and uplift us and to try and be a support system for women who may be in different circumstances to our own. So I know as a single mum how lonely it can be and how frustrating it can be. So I would always try and lend an ear to my friends who are going through the same thing as me, or people within the groups that are going through the same thing as me, because I know what it feels like, and I would never want someone to be out there with no friendship, with no friends, no support network. So I do think for us as women, it's really important that we join these networks and join these sisterhoods to try and support other women where possible.
Absolutely, Carina, I quite agree, and that's one of the things we at WEN Wales do. We have a group of mentees. We have a mentoring scheme, and what I found is, although the women who get on the mentoring scheme every year are obviously learning a lot from their mentors, one of the most valuable parts of the scheme is the WhatsApp group. and the peer-to-peer support. And even during this period of lockdown, when we can't physically meet like we're supposed to meet, and we take them to the Senedd, we take them to the House of Parliament, normally we can't do any of that. So we're meeting online. And I see Carina has posted a message in the chat. She's one of our mentees. So one of the most valuable things about this is the sisterhood that it creates, and the support network, and keeping in touch. And I think that's a really strong role for WEN in these times. I'd like to come to Sarah Rees now and just say, kind of with my final question, which is around, if you were First Minister, and there was one thing you could do to resolve care once and for all, can you let us know what that would be, please, Sarah?
I do think it would be providing a universal basic income, because you know, I was brought up by a single mum. I remember when she was lonely, desperate for work, but when we worked out how much that she would have left after paying for childcare, you know, that 50 pence wasn't worth the stress and concern of employers who'd say, right, well, you have to stay and work until 3 o'clock. And then she told me the other day how she remembers working in the city centre and knowing if she was just 2 minutes late, then she wouldn't make her bus that would get her home to pick up my brother from school. You know, why are we forcing women to make these really, really difficult choices? And financial freedom is the way to gender equality. And we know that when you talk about things like the gender pay gap, for me, it isn't a gender pay gap, it's a motherhood pay gap. The choice that you have to make isn't really a choice. You've got children, and then all of a sudden you realise that the entirety of what you earn goes on childcare, which is just astounding. It's silly, and why are we forcing people into this?
Okay, so Sarah's big solution is universal basic income, and I think it's really key to point out there's not only a gender pay gap, there's a massive ethnicity pay gap, and we at WEN would like to see companies forced to report on their ethnicity pay gap too, as another one of our policy solutions. We do have lots, and I'm sure there have been some links to our policy documents and our feminist scorecard and so on in the chat.
Just to jump in on that point, Sarah, I know that most of you will have heard of the Privilege Café, and they have set up a new page which is to post jobs, so that is more aware for the BAME community to find decent jobs. So if anyone has any jobs available, please post them to that group.
Brilliant, thanks for that, Sarah, and perhaps you can put the link in the chat. So coming to you, Carina, finally, so if you were Prime Minister, tell us the one thing you'd do to sort this caring out and to make sure that we have a really great caring system for England.
I would have a cap on the amount that nurseries could charge, private nurseries could charge, and also I would ensure that employers are encouraging parents to work flexibly or part-time, and I'd also encourage employers or force employers to offer part-time roles and job share roles, so that there isn't that pressure for mums to or even dads to be working full-time and be trying to juggle childcare. So I would definitely enforce employers to offer flexible working, job sharing or part-time work, and also put a cap on the amount that nurseries can charge, and encourage nurseries, and maybe even give some sort of bonus or funding to nurseries to open outside of the traditional hours, so 24-hour nurseries, weekend nurseries.
That's such a good idea, Carina. Thank you so much to both of our panelists. It's been absolutely brilliant discussion. And I think we've got some really great solutions there to add to some of the ones we've already got. I mean, we want, at WEN Wales, we want to see childcare from 6 months, and we need to make sure that it's available to any parent who wants it. But I really like your idea of the cap on private nurseries, and employers need to be more flexible, and as Sarah said, a universal basic income, or as Alex mentioned earlier, the thought of having a free universal childcare is kind of her her top tip if she were Prime Minister. So thank you all to everybody who came along today to the cafe. We will be sending out a recording of the cafe afterwards. Sarah Rees just wants to do one last plug for please visit Pregnant Then Screwed and complete their survey for parents. That would be really helpful because they need to hear how it is on the ground for us all, the parents in Wales and potentially England. So thank you all very much. If you're not a member of WEN Wales, please do sign up because then you'll get notification of further events. So just one last really big thank you, diolch yn fawr iawn, to Carina and Sarah, and see you all at our next WEN Cafe. We're taking a break in August, so we'll be back in September. So thank you very much, everyone. Have a great day. Thank you, Carina. Thank you, Sarah.
Thank you.